Today
Okay.
is 25th April and it's World Malaria Day. It's out there, like you said, the information is already out there. Malaria has been the highest killer of child and nursing mothers and is rated as the highest, or Nigeria is rated as the highest country with the highest infectious cases. And statistically, about 400,000 persons lose their lives per annum as because of malaria. Now, what would you say should be the way forward in terms of tackling malaria? Because the theme for this year is enhancing innovation. What kind of innovation do you think can be introduced apart from mosquito nets that we've seen already in public space? We've already used mosquito net for quite a number of times or for many years now, and it seems not to be, reducing the cases of malaria. What's the way forward for malaria?
Thank you, Tabasi. There are a lot of things I need to pick out from this your introductory remark and slash question. Yes, you are very correct. Malaria is a public health concern that has taken the lives of so many. As at a decade ago, it was the leading cause of mortality. It's caused about 2.7 million deaths annually
Hmm.
before some of the interventions we had. So that's where I beg to differ with you
Hmm.
that some of the interventions we've had has not particularly been working, like the using the nets,
Okay.
suicide treated nets. Formerly, like I said, we used to have a mortality rate of about 2.7 million annually. Now,
Okay.
what we have as at 2020, that's the
Yes.
last official
Yeah.
statistics released by WHO
Mm-hmm.
on the annual data, and that was about 600,000. Yes,
400,000.
even though that's still much,
Mm-hmm.
but it's way lower than the 2.7 million we had
We used to
about
have.
a decade ago.
Okay.
Yes, well, malaria is a major problem. We have about most 250 million cases every year, and that is underreported.
Mm.
And that's what we already know, that those that come to the clinic with document and the rest, that's about 250 million cases. Now,
Mm.
there are other things you can't even measure when it comes to malaria, like the loss of manpower, the amount of sick time people take off duty, how much the employers will lose by having persons not working, the amount of school period school children lose when they stay home, because of malaria and co. So it's actually a big problem. That's why today, the 25th of April, the whole world has gathered together to uh, lay more emphasis on malaria and shed more light on it.
Mm.
Okay, so doctor, one of the things that we talked about before you came on the show was the issue of Nigerians, the issue of people generally. We are used to this situation where one feels a slight headache and immediately concludes it's malaria, feels a little bit of fever and immediately concludes it's malaria. And then most times these persons don't necessarily go to the hospital for proper maybe test before getting to take medication from medical experts. How would you advise such group of persons as to handling malaria or handling the different symptoms they feel? Or let me rephrase: is every headache malaria headache? Is every fever malaria fever?
Thank you, Francis. This is a major problem we've been having with this malaria epidemic in our hands. Is people are finding it difficult to appropriately differentiate what is malaria and what is not. It appears malaria is the culprit everybody likes blaming for anything. You have catarrh is malaria, you have headaches malaria, yeah, weak is malaria, you have a fight with your husband is malaria. No, it's that's what we see in the medical practice. Most at times in my clinic, we see patients that are coming. I see patients that are coming and say that, oh, doctor, please give me tablets, malaria drugs. I think I know I have malaria. I say, okay. Do you have fever? He says no. Do you have headache? He says no. Are you vomiting? He says no. Are you coughing? He says no. Then why do you believe you have malaria? He says, my body is doing me somehow. My body. So, doctor, I know this is fact. I know my body. This is my body. Whenever my body is doing me like this,
And
I have
there's
malaria.
malaria.
So malaria is at times overdiagnosed. overdiagnosed. So that's why we recommend that before you treat malaria, at least for adults, you should run the malaria diagnostic test. They have like two major types. We have the standard type. That's the microscope. Use a view. You make a slide and view it under a microscope. It could be a thin or a thick film slide. I don't want to enter the details, but that could help us make a diagnosis. We could also do what is now readily available as the rapid diagnostic test, RTDs. It will help us. It's easy to use. It's cheap. It doesn't need any expertise. It's just like pregnancy, the way pregnancy test strips are.
Okay.
Use that. It will just tell you whether you have malaria or not, and it's available almost everywhere in all the local drugstores. No?
Okay. So
Okay,
it's
yeah, I initially started you off with the theme for this year's World Malaria Day, which is in nursing innovation to find a cure for malaria. Now, I asked about those innovative steps that, as a practitioner, you feel if deployed could also aid, additionally to the mosquito-treated nets that method that perhaps you said has been working. Yeah, because the numbers has reduced. What are those innovations you might introduce? I know that the vaccine has been through a process for over 3 decades now, and we still do not have some in Nigeria stand to be corrected. What other innovation can be deployed?
Well, when you say innovations,
Mm-hmm.
maybe you're thinking, most times people are thinking of something maybe high tech, drones, or computers and the rest.
Well,
Other times
technology,
it may just be that okay, what
welcome
what you
ideas.
what you are doing, just can you do the basic things well?
Mm.
Take care of environments, make sure they are clean. You may feel these things are very trivial, very elementary, but doing some of these things can go a long way in coping with malaria. I know. So, first of all, we have to start with getting our baby foods right first. Diagnosing malaria on time, treating promptly, and then putting in place basic preventive steps. Making sure that we have observed good environmental sanitation and personal hygiene and the likes of it. Now you now go to maybe some newer initiatives that the WHO is trying to push. Like you rightly said, there's a malaria vaccine that has been in the offing for about close to like two decades or thereabout.
Okay.
Sorry, closer to about decades or thereabout.
Mm-hmm.
And I think they just finished the third phase, and it's now available for countries to key into. And as it is now, I don't know that a couple of countries are into the program, Kenya, Ghana, I think, and co, but it's yet to be introduced
To Nigeria.
to Nigeria. That's one big innovation that we have there. And also, there could also have this spraying to kill most of the malarial or not all malaria. Sorry, I didn't first of all say that mosquitoes are not synonymous with malaria.
okay.
Yeah, not synonymous with malaria.
Well, okay, Doctor, we'll come back after this time
Okay.
out. We'll quickly go on a very brief time out. When we return, this conversation continues. Please stay with us. Good morning and welcome back. Yes, it's still Rise and Shine reaching you live from the beautiful hills of Abiakuran. And yes, we're still in this conversation of preferring possible innovative solutions to malaria and also to taking a critical look at some of the many ways malaria is disastrous and has endangered Nigerians. And of course, we're still here with our guest, Dr. Okeke Daniels, who is shedding more light on the subject for us. Okay, just before we went on that time out, we are trying to, give more insight into some innovation. You mentioned that the vaccine is yet to be available in Nigeria,
Yes.
but we have it in other countries. Ghana is also a part of that scheme with the WHO. Are there other ones that you might want to make mention of at the time?
Yeah, yes. They have been schemed to try to eradicate mosquitoes that transmit the malaria parasite as a plasmodium
Mm,
species. This has been a bit controversial, but some other countries, Western countries, have done that with great effect.
mm,
They do this. They use these specialized helicopters to spray a certain geographical location and then to kill all the mosquitoes that transmit malaria. That could work. But others have also argued that it's not all mosquitoes that transmit malaria. And then trying to eradicate all the mosquitoes in an area could actually adversely affect the ecosystem.
mm.
That they give humans malaria does not necessarily mean that they don't have other benefits that they have on the ecosystem and the food chain. And if you remember your biology,
Okay.
so now they are trying to say, okay, what some scientists are doing is to make the the mosquitoes sterile, so
Okay.
such that they genetically modify them, make them sterile, so that they are unable to harbor the parasite that causes malaria, which is the Plasmodium species,
Mm-hmm.
and then now release all those sterile mosquitoes into the
In the
society.
society, so we
Yes,
can be rid of the
and
ones
also
that carry the parasites.
yes, the one that carry parasites, the
Mm.
head. Then, but then you have more mosquitoes around. But then
Mm.
those mosquitoes biting you are not transmitting malaria.
Malaria.
Immediately.
Yes,
Okay.
Okay.
So they're
so
just chopping and chopping their life and you're just giving them food. All right. Now, so your focus as a medical doctor has to do with family. And we know that one of the people that are oftentimes, very vulnerable are the pregnant women and children mostly. As a family doctor, how would you counsel pregnant women, mothers, intending mothers, and mothers with babies and children to go about, protecting their children from um, being bitten by mosquito and all of that?
Francis, I'm quite happy that you asked this question. Is of all the malaria deaths we have, about 80% of the deaths due to malaria are, are on children, under 5 children. So that's quite alarming. So there are some 80%, and most of these 80% now are in sub-Sahara Africa.
Africa.
Mm.
And of course, Nigeria contributes the highest number of deaths,
We are
Mm.
the Baba.
31%.
Mm.
That's almost like a third of all the deaths you see
Mm.
in malaria is from Nigeria here. That's very alarming. Let me just deviate a bit because I want to say that the very first death I saw in school as a medical student was that of a young child, 4-year-old male, that died of malaria, cerebral malaria. Then I see up until then I didn't really know how deadly or how serious malaria was, and I always felt that, oh, this is malaria. You know, when someone have malaria, it's headache, paracetamol, you go and rest, you to go. I didn't know that this could actually lead to people's deaths.
Mm.
Now there are people that are at risk, like you said, the pregnant women, under 5 children, people that have low immune systems, low immune response, like HIV patients, and some or others that have other illnesses like hematological illnesses, sickle cell patients, and co. And importantly, also importantly, those that are non-immune travelers. When I say non-immune travelers, I mean those that live in non-malaria endemic areas, like maybe the western places, France, US, UK, and co, where there's no malaria. And they now travel down to a place where there's malaria. So they don't have any immune system to even help them fight. All of us we have been here,
Yeah.
here. So we at least we have a little bit of immune system that will help us fight malaria. Also, those people, in fact,
Okay, your counsel to us, how would you prevent the vulnerable, the under five children, and the pregnant women? What are the information strategic or specifically for them to help them stay?
they have
Uh,
they have a lot of programs for them.
mm,
For the pregnant women, once you come to the antenatal clinic, they will look out for signs of malaria. They give that is in most in some local governments, they give them free insecticide treated nets for them to sleep under, they and their newborn babies. And
mm,
then they are given what we call intermittent preventive therapy in pregnancy, IPT in pregnancy,
mm,
where sulfadoxine and pyrimethamine, what we popularly call Fancida,
okay.
is given to them at week 16 and week 20. That's in second trimester. Given to them 3 doses, a month apart each. This will help prevent the deadly effects of malaria on them, because malaria has been shown to cause, of course, maternal deaths, causes intrauterine growth restriction. That's the mother coming out with small babies, or even uterine fetal death. That's child dying, either abortion or stillbirths.
Wow.
Okay.
Yeah.
Well, I'm concerned with this part because countries like US don't have malaria. They have because there are no mosquitoes there, and it did not affect their ecosystem. So why is the argument that if the same method is brought to Nigeria, the idea of maybe getting an helicopter to fumigate some part of some communities or part of the country to ensure that the mosquitoes are taken out. Why is the argument that it will affect the ecosystem in Africa or in Nigeria?
Yeah, it's some of these things are they are not the policies that you can readily just use. Some of them are very cost effective.
Mm,
I know you remember the scandal of was it last year, where the Ministry of Health said they were going to wanted to loan 200
2 billion
million
million,
dollars
yeah.
to buy insecticide net to manage malaria, and then everybody were up in arms,
Mm-hmm.
screaming and shouting, and I don't. So some of these policies may not be
Very visible.
visible in thank you,
Mm,
in our vicinity.
mm.
Yeah, you can imagine the sheer number of amount of land mass Nigeria has. How
Mm.
would you now
Be
cover
able to
that
cover that.
with a helicopter spray? I don't know whether it's realistic.
Well, what's the place of research now? Is it that there's no proper research as to how the viability of that?
Yes, there's research ongoing. In fact, there's this a program we have, this the rollback malaria program being organized by the Ministry of Health, and one of their key pillars is focused research. So a lot of research has been ongoing and is still ongoing. What we now advocate, or the WHO advocates now, is we use, instead of using these sprays, insecticide sprays, Raid, Mobile, I don't want
Mm-hmm.
to market anybody's
Mm-hmm.
products here. We should use uh, um, indoor residual sprays that
Mm.
you spray them in your house once a year, and they stay in the walls, and then offer you a year-long protection against
Protection. Okay.
So
against
how
mosquitoes. So
how accessible are these indoor residual sprays?
they're actually there. They are there. If you ask, if you ask, they are there.
So is it like something you can walk into a pharmacy and then you ask for them and you get to buy it? Or is something that you have to go to the hospital or designated hospitals to get it?
I don't think they are readily available. I think there's offices or services that they offer. So there are people that offer that. Maybe if you
Okay.
here, so most likely those are to deal with environmental sanitation
Sanitation.
and
Okay.
fumigation would offer us those services. So I'm more, of course, as in as much as we are looking at the high falutin things, the basic ones also
Mm,
use of insecticide treated nets.
mm.
It's been shown to work, and it's
Okay.
still working. I know
under the hot temperature in Nigeria
that's.
and no electricity.
I don't think it's because of the heat. Yeah, I sleep under the net,
Okay.
and I don't think there's any difference between me sleeping on a net and when I leave it open. No, I think it's just the perception that
Oh.
oh you are being caged or something of that nature.
Mm.
It's a mindset. Once you are able to walk past that mindset, I don't you actually enjoy using the net.
Well, thank you very much for coming through on the program and sharing your thoughts with us. We've been speaking with Dr. Daniel Okeke. And Doctor, your last thoughts on this subject before we call it a day.
Malaria is a big issue in our society. I want us to, at least if not for anything, so we sort of wait for the government, do the little you can, put nets on your, sleep under your net, inside thread nets, put nets on your doors and your windows, clear all the pools of water around you, and keep your environment hygienic.
You've said it all. Basically, those are the basic and most simplest way to prevent malaria. And just like they say, prevention is better than cure. Yes, there's that we can do. And while government works towards doing their bit, yes, we can also do our bit to ensure that we have a malaria-free society.